Okay, so thank you, Jonathan, for taking the time out and speaking to me today. So for Men's Health Week, for this day, we are going to talk a little bit about COVID. But first of all, I was just wondering if you could tell me a little bit about yourself, which department you're in, how long you've worked for the council.
So my name's Jonathan Roberts. I'm part of the IT service desk team, and I've been working in the council for the last coming up onto my third year now. So two and a bit years, but that was mainly in the leisure side, and now I've come over here with the lockdown and everything. So I've ended up staying here permanently.
Okay, and obviously because of the pandemic, um, did that take like a toll on your job role within the leisure industry? Is that the reason you did the switch and the change?
So with COVID and everything anyway, we got redeployed from being in leisure. So leisure was shut. We had to go and do other jobs within the council. So getting shipped off into the IT department, I ended up getting on with the team just as much as I did with everybody else at leisure. And I thought at the time, why leave a team like this when I'm enjoying it? So when they offered me a full-time spot, I was just like, snap their hands off and taking that.
Fantastic, brilliant. So yeah, it is quite a change really in your career, but obviously with
Yeah,
regards to the pandemic, it did affect obviously your job.
yeah.
But how did it affect your well-being mentally and physically?
Uh, so it's one of them. I'd probably say mentally it was draining because it was just a matter of trying to split up your personal life to the work life when it ended up working from home. Because you'd start work at 9 a.m., finish at 5, but it doesn't feel like you're leaving work because you're still in the blooming same place that you're working at. Um, Physically, it's probably ended up affecting me just as much because I couldn't go anywhere. Whereas
Yeah.
I enjoy going on my walks and stuff. So, um, not being able to actually go out far and go into the countryside and everything and do what I enjoy doing, like going up to the lakes and stuff, it ended up impacting me, and I think I've ended up losing quite a bit of weight.
So maybe that's a good thing then, but
Oh,
some people
it
it might
depends how you
might not
look at
be.
it. I didn't
And
have a lot of
how do
weight anyway.
how do you normally keep healthy physically and mentally?
Uh, I see it's one of them. I think physically, it would be literally like I said, going on my walks and probably playing football every weekend and that. Um, Mentally, see, it would have been one of them as well. With having like, say for example, you've got your football and stuff as well outside of work. It was always great. Looking forward to going there at the end of the week, but obviously with that then being no fans allowed. You kind of still fell into the same rut as when I'm trying to separate work from doing my home life as well. So it's still just a pain, but you got to crack on and do what you can do with
Yeah,
the times that we've got at the minute.
yeah. And with regards to COVID, I believe you've had your first vaccine, is that right?
Yes, that's right.
And did you have any side effects? Were you anxious going to get the jab or before it?
I am. I see it now. I would say I was anxious before I got the job just because I do not like needles for the life of me. I hate needles. I could pass out at the sight of it. But I didn't. That's lucky enough. So I think once I got there and sat down, my head was a bit more settled at that point. For a side effect of it would have been literally feeling like I had a dead arm. So it was just, I mean, literally a quick 2 second thing, but within the space of about 2.5 hours after having the injection, I probably felt like someone had probably punched me in my arm. But that's about as much of feeling as I had from it. And that lasted like 2 days.
And which vaccine did you get? Did you get the Pfizer or the AstraZeneca?
Yeah, I got the Pfizer one.
Pfizer. Okay, great, great. And have you had COVID or have you contracted COVID throughout this pandemic?
Unfortunately, yes, I was one of the few that's ended up catching it over the time. I got it back in October, At that point, it was still kind of new when it was coming in with everything. Again, with that, I ended up losing my sense of smell and my taste, but nothing else was really affected with me. Where I've heard other people have like been really bad with it. I was probably
Yeah.
fortunate enough not to fall into that category of it. Um, I mean, again, it's one of them. I could have fallen under the line of it because of my smoking habit, which is probably the worst bit. But again, it wasn't as bad as I first feared when I got it. Once I'd
Okay.
rolled it out, it seemed okay after it.
And do you live with your parents?
I do.
So obviously, did you have to self-isolate from your parents?
So with that, my stepdad also had COVID as well. So it was basically me, my stepdad, that were having to try and stay away from my mum. Now, at that point, you had my mum that was staying pretty much downstairs for the time, and you had my stepdad and me upstairs. Now, anytime we needed to go get something, it was a matter of you're going to have to get the hell into that corner over there whilst we shuffle through and come back up. But for the see, because it was a bit weird. Like if you'd got it, you had to isolate 10 days, and then if you
Mhm.
didn't have it but you were in the same household, you isolated for 14 days. So it was a bit. We basically ended up all isolating for 14 days anyway. So it was safe basically.
Yeah. Okay. And obviously, with your smoking, you mentioned that that's possibly something that you were a little bit anxious about, especially with catching the COVID. So did you feel
Yes.
because you smoke, you were more you possibly would have been more vulnerable?
Yeah, I would have probably said that. See, with me being my age anyway, I'd have a bit of a laugh here and there and stuff. Um, when it came to COVID at first, people would joke about saying, "Oh, I'm going to be the first one to get it because I'm a smoker and everything," and little did I know they were right. Because like they were saying, if you've got underlying health conditions, if you're a heavy smoker and all this, like you're more than likely going to catch it. Here I am.
Yeah.
But
How many cigarettes do you smoke a day, Jonathan? Roughly.
uh, I, I would have said probably at the time that I got it, I was on about a 10 a day. Since that, I've cut down to about 4 to 5.
Oh wow, fantastic. So you've cut it down by half.
Yeah, I'm slowly trying to get off it anyway because I, I might have been left with a cough from the COVID itself. I might not have. It's just one of the. I don't know if it's the smoking, if it's that. So I just got to cut it on the head basically, and let's
Yeah.
keep trying to get rid of all smoking.
Yeah. And are you aware that the council does offer help and support with regards to quitting smoking?
I didn't know with smoking. No.
Yeah. So you could ring the hub and you could ask to make an appointment with a health trainer. And one of the health trainers could go through all the relevant resources that we have available and also externally to help you try and quit smoking. So I'm not sure if that's something that you'd like to do after this call. I know some of the health trainers would obviously look at goal setting, which you've already started yourself. As you mentioned, you were smoking 10 and you've already cut that down by half, which is an amazing achievement. So well
Big
done for
jump.
that.
Big jump.
Yeah, yeah.
But it needed
So
to be
it
done.
sounds like you want to quit and you are going in the right direction,
Yeah.
but there is that extra support there for you. You can just have a look on Teen Talk as well. All the information is on there. Now, with regards to Mental Health Week, a little bit of COVID, a little bit of smoking. What are your top tips that you would give a fellow male colleague relating to those topics?
What as in so with the smoking and the COVID,
Yeah, it can be separately, it can be together.
don't
Any
smoke.
top tips?
I'd say that to any young guy ever just or not even a young guy, just anybody young, just don't smoke. But if it's the smoking and the COVID, like if you are so worried about the COVID, I'd put the fag down straight away because Otherwise, you're going to be in my boat and you'll end up getting it, and you don't know if you've got an underlying health condition. It might be something that you've not picked up on, but it's better not running the risk.
Yeah,
It's always
definitely.
better staying active to keep your mind mental for it. So got to keep trying to find different routes to not have a cig, and at the same time you're stimulating your own mind to put you off having a cig.
Excellent, perfect. So thank you, Jonathan, for taking the time out and
No
speaking
problem.
to us today.
It's all right.
And make sure you stop smoking.
I'm trying my best.
Thank you, Jonathan.
No problem, Lucia. See ya.